Bags under the eyes are basically a puffiness and a dark circle or hollowness that tends to be in the lower eyelid. Generally, you start to notice it in the 30s and 40s, but usually it starts to get a lot worse in your 50s and 60s. There are several causes for bags under the eyes. The most common cause is genetics. People who tend to have family members who have dark circles or bags under the eyes, father, mother, aunts, uncles, grandparents, they will tend to see bags under the eyes at a younger age than someone else. Other causes for bags under the eyes are smoking, because it destroys the elasticity in the lower eyelid, dehydration or not drinking enough water. Lack of sleep is also another common cause. A lot of people work really hard, they stay up late, they're dehydrated, they don't get enough sleep, they're 8 hours of sleep, so lack of sleep is probably one of the causes as well. Probably some of the best ways to prevent lower eyelid puffiness or bags under the eyes is to do as many of the home remedies as possible. The most common ones are, of course, getting lots of sleep, getting a full 8 hours of sleep, and also staying hydrated. Those two are probably the most important. Also avoiding anything that causes sun damage to the lower eyelid, which breaks the collagen and elasticity. For example, eye creams that have an anti-aging effect and also sunscreen. Anything that has sunscreen that protects the lower eyelids will also help prevent damage and loss of elasticity, which allows the fat pads to herniate or bulge out more. We do have other products that help improve the texture of the lower eyelid, the crepiness, and also the elasticity, and those eye creams have a little bit of retinol in them, which is proven to improve lower fat pads or puffiness under the eyes. Other things that can also improve the lower eyelid are sinus issues. If you do tend to have congestion, you do tend to get frequent sinus infections, you can also use a neti pot or clear your sinuses out with some sort of sinus rinse. I think that's helpful too. There are several ways to improve the bags under the eyes. We'll start with the surgical options, although it's usually our last resort. If the bags are really prominent and we don't feel like non-surgical options are going to work well, we'll usually recommend the surgical options first. The surgical option is basically a lower blepharoplasty, where we make an incision on the inside of the eyelid and we actually remove the fat pads. There's 3 fat pads in the lower eyelid, and we remove a portion of those to basically bring in the puffiness and make it less visible. Oftentimes during the surgery, if we can reposition some of the fat into the hollow part of the tear trough, that'll help improve the dark circles of the puffiness in the lower eyelids. So surgically, the lower blepharoplasty is the best option. The most common non-surgical treatment is fillers under the eyes. We generally use the Restylane family of injectables, and we'll use regular Restylane or also Restylane Refine, which is a newer product on the market. And these are hyaluronic acid fillers that we use to inject directly below the fat pads or puffiness and also directly into the darkest part of the tear trough. Now, these fillers generally last about 9 to 12 months, so they do need to be repeated about once a year, but they are generally a 15-20 minute procedure, and they're easy to tolerate. There is one other non-surgical option which is unique to our practice. We're one of the few practices that has an under-eye treatment called carboxytherapy. And this is a carbon dioxide gas treatment that's injected usually in a series of 6 treatments. It's a 5-minute treatment, and we inject the carbon dioxide gas right into the lower eyelid, and that gas stimulates circulation, improves the dark circles under the eyes, and brightens the tone of the lower eyelid slowly over the 6 treatments. There's lots of filler options for under eye treatments. We have a lot more choices now than we did even a few years ago. The main reason why our practice chooses the Restylane family for the under eye treatments is because we've noticed that there is the least amount of delayed water attraction or swelling. In other words, some of the other products, particularly in this area, can look good for the first month or two, but can sometimes attract too much water down the road. So in general, we find that the Restylane products work the best for treating puffiness or dark circles under the eyes.